welcome to Manuever tutorials! Before we continue with the tutorial presentation, let me introduce myself and my group members. My name is Tasnim Hussein.
Hi, my name is Rabiatul Ashikin binti Nazri.
Hi, I am Siti Haja binti Muhammad Syafiq Ta'o.
My name is Tunku Aiman Naim from AS239C.
Hi, my name is Wan Mirza bin Abdullah.
Hi, my name is Siti Nur Syafiqah binti Muhammad Saiful Aziz.
Hi, I am Safira Nurina binti Sabruddin.
Hello everyone. Today we are going to discuss about airway maneuver. So, in this video, we will explain the introduction to airway maneuver, anatomy of airway, airway assessment, airway management system, and reducing the risk. Airway maneuver is an essential technique to be learned in first aid care in case of emergency and clinical situation to ensure an open airway for adequate ventilation and oxygenation. Purpose of airway maneuver: first is to clear or prevent airway obstruction. Second, to facilitate effective ventilation and oxygenation. Lastly, to assist in advancement airway management such as intubation or ventilation.
Next, we move to the lower airway that are located below the larynx and are involved in moving air into the lung. First, trachea. The trachea is the main airway that starts at the bottom of the larynx and extends down to the chest. It carries air from the upper airway in the lung. It is a flexible tube with rings of cartilage to keep it open. Next is bronchi. The trachea divides into the two main branches called the right and left bronchi, one of each lung. These bronchi lead into the lung and further branch into smaller and smaller tube. The bronchi help direct air to each lung. After that, the alveoli. At the end of the bronchioles, there are tiny grape-like sacs called alveoli. They are the final destination for the air, which are where the oxygen from the air is exchanged for carbon dioxide into the blood. The anatomy of the upper airways refer to the that allow air to travel from the outside environment into the lung. It's like a road for air. Firstly, nasal cavity. Air enters the body through the nose or mouth if the nose is blocked. It contains nasal cochlea, which increases surface area for humidification and filtration. Next, pharynx. After the air passes through the nose, it enters the pharynx, which is a tube-like structure at the back of the throat. The pharynx is divided into three parts, which is nasopharynx is behind the nose where air moves, oropharynx behind the mouth, which also carry air and is where you can see your tonsil. Laryngopharynx, the bottom part of the throat near the larynx. Next is larynx, which is a wash box. The larynx sits at the top of the trachea and is responsible for voice production. It also acts as a gateway, making sure air flow into the trachea. The larynx contains the vocal cord.
Ways for clearing an obstructed airway. For conscious adult and children, encourage coughing if partial obstruction is present. Stay behind the person, wrap arms around the waist and perform abdominal thrusts. For unconscious adult and children, perform CPR and check the airway for foreign objects. Remove visible obstruction with fingers swept if only visible. For obese and pregnant, stay behind the person, wrap arms around their armpits or chest. Position thumb side of fist on the middle of breastbone. Grab fist firmly with other hand and thrust backward sharply. Lastly, for infants, alternate 5 back blows and 5 chest thrusts. Air maneuvers are like magic trick to help someone to breathe when the things get tough. They are used in emergency like choking or where someone is unconscious and their airways need a little help for staying open. One of our stars of today's show is head tilt and chin lift. This one is a total lifesaver and it's super easy. Just tilt the head back, lift the chin and voila, you are the hero of the moment. Ready to see how this simple move works? Let's jump in and practice.
You nak gula-gula tak? Ana akan gula-gula dulu. Itu jangan.
First, kneel beside the casualty at their shoulder level. Second, place one of your hand on casualty's forehead and apply firmly pressure with palm to tilt the head back. Place fingertips of other hand under the bony tip of lower jaw and bring chin forward. And it is important to not use your thumb to lift the lower jaw, and please be careful not to press into the soft tissue under the chin with fingers, as this could close the airways. Fourth, lift chin forward until upper and lower teeth are almost brought together, but be careful, do not close the mouth. If needed, use thumb to gently pull down the lower lips to keep the casualty's mouth open. First, put your cheek above their mouth and nose so that you can feel the breath on your casualty's cheek. If you listen less than 2 breaths in 10 seconds time of period, it may be casualty is doing agonal gaps.
I think you already late to the class. Let's go, hurry up. You're at least 5 minutes. Let's go. I can't breathe.
Oh my god, Safra, are you okay? Safra, is she dead?
No.
Oh my god.
I think she collapsed.
Collapse? Collapse from asthma.
What to do?
I think I know what to do. We need to do Airway's maneuver with your thrust. So step 1. Position yourself at the patient head. Step 2. Place your index and middle finger under the jaw angle and thumbs up on the chin. Step 3. Gently lift the jaw upward and slightly forward. Step 4. Monitor for breathing and adjust as necessary. There are 4 things in airways management care. The first one is monitor patient's conditions. We need to check the oxygen saturation, heart rate, and respiratory rate continuously. We also need to watch for signs of distress such as low oxygen level or difficulty breathing on the patients. Next, confirm proper airway placement. We need to check for equal chest rise, breath sound, and absence of stomach sounds. The next one is prevent complication. We need to avoid infection by using sterile techniques such as glove and device equipment when handling. We also need to make a monitoring and early detection as we need to watch for early sign for complication. Other than that, is avoiding aspiration to prevent vomiting and clear the airways immediately. Lastly, documentation. The documentation must have the type of airway device and size used, time and method of placement, confirmation of placement, and suctioning frequency and secretion characteristics.
Here are some of the ways to reduce the risk during an emergency. First, we should always prioritize using non-invasive measures and only prioritize using advanced techniques if only needed. Next, we should also always regularly assess the airway of the patient for any patency and signs of airflow. Third, we should also only use the necessary techniques and equipment if needed based on the condition of the patient, and so that we can properly give our expertise. Next, we should also regularly train and continuously do first aid so that we can properly give the proper techniques and also the proper medication given to any first aiders or any patients if necessary.